Hello, myself Dr. Samiksha. I am the homeopathic psychiatrist and the counselor. I have been practicing since 6 years in Manome Homeopathy and Counseling Center at Pune. Today I am here to talk about the insomnia. So I think we all heard about the insomnia word. अगर नींद नहीं आ रही तो वी यूजुअली कॉल्ड इट कि अरे इंसोम्निया हो रहा है. अगर किसी ने बोल दिया आपको कि अरे मुझे रात भर नींद नहीं आई तो वी कॉल्ड इट कि अरे तुझे शायद इंसोम्निया हो रहा है. So, layman also we know about the insomnia, but what is exactly insomnia? So let's today talk about the insomnia. So today my presentation include the definition, the causes, etiology, risk factor, diagnosis, treatment, and the homeopathic management. So what is exactly insomnia? So if you are a person having trouble in falling asleep, trouble staying asleep or trouble falling back into sleep, अगर नींद नहीं आ रही है properly या फिर जगे ही रह रहे हो या फिर नींद आने के बाद फिर से उठ के नींद आने में तकलीफ हो रही है, तो that we called it as a insomnia. But what exactly is? So it's a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early or not be able to get back to sleep. मतलब अगर नींद नहीं आ रही है properly और सोने के बाद भी फिर से जग रहे हो और फिर से नींद आने में तकलीफ हो रही है या difficulty हो रही है, and most probably you are feeling tired after waking up and you did not feel fresh, you does not feel fresh. It can not only affect your energy level and the mood, but also your health, work performance, and the quality of the life. So obviously, if you are not slept well, अगर नींद properly नहीं आई है, तो मॉर्निंग में ना आपको काम करने का मजा आएगा, ना आपका मूड फ्रेश होगा, ना आपको ऐसा लगेगा कि कुछ करना चाहिए. So because of your sleep disturbances, your energy level is very low, and it affect your quality of a life. So many a time patient ask me, how much sleep is enough for me? So like 5 hours is sleep enough for me, or the 4 hours, or the 6 hour. So thus how much sleep is enough, it's always varies from person to person. But in a most adult, we usually need 7 to 8 hours of the sleep. But the you should feel fresh in the morning. If you are feeling tired after waking up, that means there is a problematic sleep. But if you are feeling fresh after, even if you are sleeping for 2 hours or the 4 hours, if you are feeling fresh, that means your sleep is enough. So the quality does matter, not the quantity. So at some or the other point, we all experiences short term or the long term. So what is short term or the long term? Insomnia. So the short term, which also called as the acute, which can last for days or the weeks, it usually the result of the maybe the stress or the traumatic event. Like for example, office में बहुत ज़्यादा tension है, या घर में किसी की death हो गई है, या family में कुछ problem हो रहा है. So it's an acute thing which जिसकी वजह से नींद नहीं आ रही है. So that is the acute insomnia. But some people may have a long-term insomnia, when we call it as a long-term insomnia, which can last for a month or the more than the month. So it is greater than 1 month. If it is less than 1 month, we call it as an acute insomnia. Like for example, अगर मुझे आज नींद नहीं आई है और मैं कल नहीं बोल सकती कि yeah, I'm having an insomnia. No. At least if you are not able to sleep, so there is a trouble falling asleep or you are wake up throughout the night, so at least 3 times per week, if you are not sleeping well, that means we can term it as insomnia. So we have a sleep cycle, right? So there is a REM sleep cycle and the non-REM sleep cycle. So what is REM? Is the rapid eye movement sleep. Okay, so there are the different stages of that rapid eye movement sleep. So when you go to the sleep, maybe you go to the sleep at 10 o'clock or the 11 o'clock. So first thing or the stage 1 is there is a light sleep. Right after you drift off 1 or the 5 minutes. In stage 2, there is a light sleep. Your body is relaxed and it's best to wake up during this stage. So in stage 2, it's may possible कि अगर छोटी सी भी आवाज आ रही है या थोड़ी सी भी आवाज आ रही है या कहीं पे कुछ सुनाई दे रहा है, तो you may be wake up. in stage 3, very called as the deep sleep. So in this sleep, your brain and the body recover. अगर इस स्लीप में अगर किसी ने उठा दिया तो you may feel dizzy or the groggy. In stage 4, where is a proper sleep, it is called as when you go to the in a deep sleep where you may see the vivid dreams or feeling of unrest upon awaking. Okay, so why this stage is important? Because in insomnia, where in acute stage or in the chronic stage, you may waken up in stage 1, stage 2, stage 3, or the stage 4. So what causes an insomnia? So there are the various causes. The first important cause is the stress. Like we are living in 2024 now, where the stress is the common cause. Stress may be because of the relationships, stress may be because of the work, stress may be because of the family, stress may be because of the different things. So we are all living in a stress. That stress is the main factor which maybe can cause a insomnia. So we may overthink about certain things at night, or we are watching some we are just thinking about something, so that stress can lead to the insomnia. Second, the important cause is the irregular sleep schedule. The proper sleep at night is very important because it can refresh your mind and you feel fresh in the morning. But if you have a irregular sleep schedule, like for example, if you are sleeping in the morning, if you are sleeping in the afternoon, and if you are sleeping in the evening, obviously at night किसी को नींद नहीं आएगी, correct? So you need to regulate your sleep schedule to treat the insomnia. Third important cause is the lifestyle. As I said, we are living in a 2024. So our lifestyle has been tremendously changed. Maybe because of that, there are the various factors we are experiencing right now. So lifestyle, maybe you're just watching some movies at night in phone, in laptops, or you are drinking some caffeine or alcohol that can hamper your sleep cycle. Some mental health disorder. So if you are suffering from a depression, if you are suffering from anxiety disorder, if you are suffering from the OCD, so there are the various mental health disorder which can also cause the insomnia. Physical pain. Obviously, if you are having a physical pain, so pain in the back or pain in the knee, pain in the leg, that can lead to the disturbances in the sleep. If you are on some certain medications, or if you are having some neurological disorder. So neurological disorder, for example, Parkinson's, if you are having a Parkinson's, it can lead to the insomnia or the Alzheimer. Age, yes, age is the important factor in insomnia because if you are getting older, your sleep is going to disturb. Or if you are having other sleep disorder, or even in the pregnancy, we must heard about that. In pregnancy, everyone's sleep get disturbed because there is a movement going on in the belly, or there is a positional difficulty during the sleep. So it can cause the insomnia. These are the primary cause of the insomnia, but there are the certain risk factors also. So what are the risk factors? So for example, there are mainly the three risk factors: environmental, behavioral, and medical. So first is the environmental. So environmental, like excessive noise or the temperature of the room. So for example, अगर मुझे बहुत ठंड लग रही है and AC बहुत हाई स्पीड पे शुरू है, तो obviously मुझे नहीं नींद आएगी, या बहुत ज्यादा आवाज आ रहा है एंड आई एम अ पर्सन हु नीड अ क्वाइट टाइम और द क्वाइट इन स्लीप, सो मुझे नींद नहीं आएगी, या टू मच लाइट्स गोइंग ऑन, और इफ हॉस्पिटलाइजेशन, or if you are moving from one place to the another place, so that environmental factor is responsible, which can hamper your sleep cycle and which can lead to the insomnia in acute or in a chronic stage. Behavior, as I said, the lifestyle or the sleep schedule, if you are going to bed at a different time. So for example, कभी इवनिंग टाइम पे सो गए हो, कभी मॉर्निंग टाइम पे सो रहे हो, या कभी आफ्टरनून टाइम पे सो रहे हो, so it can hamper the sleep cycle. Caffeine. कैफीन इज द इम्पॉर्टेंट पार्ट. वी ऑल नो राइट कि अगर कॉफी पी लेते हैं तो नींद नहीं आती है, बिकॉज इट अफेक्ट इन योर ब्रेन एंड इट अफेक्ट इन योर sleep cycle, even in the alcohol. And stress, as I said, death of the friends or the family, it can lead to the behavioral changes in us also, and the hampered sleep cycle, lifestyle changes, and the napping. So medical, as we earlier talked about, if you are suffering from any sleep disorder like sleep apnea or the restless leg syndrome, dementia, depression, anxiety, any heart diseases like cardiac diseases or the stroke or pain or the diabetic, it can lead to the insomnia in acute or in the chronic format. So what are the mainly symptoms of the insomnia? So if you are having a difficulty in sleep, or if your sleep is disturbed, so you may feel the irritable, depression or anxiety. So you are having a difficulty in paying attention, focusing on the task or remembering anything. So at work, you are failing or you are not focusing. So not feeling well rested after a night's sleep. So there is continuous worries about sleep or difficulty falling asleep at night. And the main symptoms is daytime tiredness and the sleepiness. You feel tired and the sleepiness all throughout the day. So the complications of the insomnia. So if you are not getting a proper sleep, there are the certain complications. So what are different complications? Your blood pressure may be fluctuated. So there is a risk of the heart disease. There is a risk of diabetes, obesity. Your immune system will not function properly, and the psychological problem. So if your sleep is getting disturbed, so your brain may not function properly. So there is a risk of depression, anxiety, or you are not able to think properly. So there is a slow reaction time and your performance is getting hampered. So there are certain tips to prevent insomnia. So how to prevent insomnia? So there are the various factors as we earlier talked about. So if we can prevent that, if we can control that, we can lead to the healthy sleeping cycle. So avoid taking naps. So don't go to sleep in the morning or in the afternoon or in the evening. You can take a nap in the afternoon, but the time duration matters. So if you are sleeping in the afternoon for 3 to 4 hours, in a long nap, you're taking a long nap. So obviously it hampered your night sleep. Avoid alcohol, caffeine, and the tobacco, as it hampered your brain and it's hampered your heart, it's hampered your sleep cycle also. Try not to eat too late. Limit screen time before the bed, maintain a healthy lifestyle, and have a consistent sleep schedule. So if you are going to sleep at 10 o'clock or the 11 o'clock, you must go to sleep at 10 or the 11 o'clock. So having a consistent sleep schedule will help you to prevent from insomnia. So there are the tips, certain tips for beating the insomnia. So create a good sleeping environment. Understand your rhythm, understand your cycle. Stick to a regular nighttime routine. Eat food that help you sleep. Simple exercises, aromatherapy, or the psychotherapy. It will also help you. So there are the homeopathic management. So insomnia has many cures and the treatment option. So homeopathy is considered to be the important and the very effective form of the medication which treat the insomnia and related sleeping disorder. I will advise you, if you are suffering from insomnia or if you are feeling that you are suffering from insomnia, don't take these medicines by himself. Talk with your homeopathic doctor and then only take medicines, because a homeopathy works on a person, not on the disease. So every if I am here, if the patient comes to me, the two patients comes to me for the insomnia, I will give one medicines to the another and one medicines to the other. I will not prescribe the same medicines to same for the same disease. But here I'm telling you certain medicines also which can help in the insomnia. So first is the coffea cruda. So this remedy relieves the sleeplessness with the worries, overactive thoughts, and the hypersensitive to pain. Second is the naxomica. It can relieve your irritability, sleeplessness, and digestive trouble associated with the overindulgence of food, tobacco, or the alcohol. Cilicia, it's a useful remedy for nervous people with a low stamina, जो बहुत जल्दी थक जाते हैं and they have insomnia. The person often goes to the sleep at first, but awkward suddenly with the hot or the surging feeling in the head and find it hard to fall asleep again. People who need this remedy usually have an anxiety trip and some having a sleepwalk frequently. Staphysagria, which can help in relieve the physical symptoms. Sleeplessness, irritability, which caused by the grief, repressed angers, or the vexation. And the zincum metallicum, this remedy can often have a insomnia from a mental activity, so overexertion, which can wound it up in an overwork or naturally inclined towards the nervousness and just have a trouble relaxing. So the legs and arms often feel extremely restless and lying still in a bed may be impossible. So even during the daytime, a person who need this remedy may feel a constant need to move the muscles. So these are the certain medications, but there are many medicines for insomnia in homeopathy. So you should talk to your homeopathic doctor before taking medication. Don't take a self medications. Okay. Thank you.